HIV is a virus which attacks the cells of the body's immune system, and over time, HIV can destroy so many of these cells that the body can no longer fight off infections and disease. If left untreated, these infections or cancers take advantage of a very weak immune system and signal that the person has AIDS, the last stage of HIV infection. According to the World Health Organization, at the end of 2014, there were 36.9 million people living with HIV, and of these, 2.6 million were children under the age of 15. However, HIV has a woman's face and is the leading cause of death among women of reproductive age. Today, there are 16 million women in the world living with HIV and AIDS. The vast majority of those currently living with HIV and AIDS live in middle and low-income countries. According to the statistics presented by the World Health Organization, only 8 countries account for 57% of new HIV infections, and 5 of those 8 countries can be found in one continent. The continent of Africa has the biggest HIV epidemic in the world. In 2013, there were 330,000 new infections, while 200,000 South Africans died from AIDS-related illnesses. However, a large portion of these infections and deaths occur in sub-Saharan Africa. According to statistics, of the millions of HIV-positive people in the world, over 60% of them currently live in sub-Saharan Africa. Due to the high rates of poverty, the unsanitary conditions, the high rates of sexual violence, and the HIV-related stigma, Southern Africa has continued to lose the battle against HIV, and as a result has paid the consequences. According to UNICEF, of the 330,000 estimated number of children born with HIV, 90% were children born in Africa. Predictions made by the Joint United Nations program regarding HIV and AIDS in Africa suggest an alarming and systematic rise in the infection and mortality rate, which could ultimately lead to societal disaster. A large number of factors contribute to this. Cultural stigma prevents people from getting tested and treated for HIV and AIDS, contributing to the high mortality rate. Similarly, without being properly educated about the topic and being provided with the proper instruments to ensure their health, people continue to fight a losing battle. However, there are also many people who are reluctant to accept aid after the numerous fake cures they have been presented with. The most horrific of these cures being the rumors that suggested that having sex with a virgin would cure HIV. This rumor ultimately resulted in the rape of many young girls. With the numerous fake cures and the disastrous results, it's no surprise that the population is reluctant to accept help. However, this dreadful history does not need to lead to a horrible future. Today, both governments and organizations are prepared to combat the rocketing infection rates associated with HIV. They have one goal: to educate the public and ensure that they are provided with everything they need to help prevent and treat HIV. The first step to solving the problem is to destroy the stigma surrounding the issue. By encouraging the population to get tested and treated, they can minimize the number of people who will be infected. In 2010, the World Health Organization and the South African government created the largest rollout program in the world, achieving a 75% increase in HIV treatment access. And to ensure that they got proper coverage, the South African government employed task shifting, referring to the reallocation of tasks among available staff. Many other non-profit organizations have also shifted to focus on the prevention and treatment of HIV in Southern Africa, in an attempt to minimize the number of HIV-related deaths. Additionally, the National Institute of Allergy and Infectious Diseases has created an early-stage HIV vaccine and is hoping to test it in South Africa very soon. The trial is slated to begin in November 2016 and is currently pending approval. While the statistics and the attempts so far have been dismal, multiple organizations and governments are concentrated on finding an end to the HIV epidemic. Whether it is to minimize the number of HIV-related deaths or to ensure a brighter future, the world needs an HIV vaccine because this is an epidemic, and you're either affected or infected with HIV.